Okay, I'm showing it's time. So this is the Rio Blanco County Board of Health meeting starting at 1:15 to 2 o'clock at the Rio Blanco County Courthouse, Meeker, Colorado on April 27th of 2021. First item on the agenda is new members. So, sir, would you introduce yourself?
Hi, everybody. My name is Dr. Jeff Christupa, and I've agreed to represent the people of Rio Blanco County in matters of health, and I look forward to it.
Okay, thank you. And just an FYI, we did appoint another member this morning. I was hoping maybe she'd be here. Diane Mobley was appointed.
It's Diane Mobley.
Yes.
And we're Dr. Price Dupa. I will do my best to not get that wrong. And Ms. Mobley, are there any other additional members?
I think that's it.
Okay, and I did invite Margie Joy. She is still one of our members.
Right.
Not sure if she's on the call, so I just wanted to give her a chance to chime in if she was.
Margie, are you on by any chance? Doesn't sound like.
Okay.
Okay.
I'll get in contact with her. I know she has missed a few meetings. She's really busy. So I'll just get in touch with Laura. It's Lori. Okay, so if Margie's no longer wanting to serve on the board, I'll just contact Lori, and then we'll have then one more position. Okay. And just what is the process for that for individuals if they wanted to?
They fill out an application and submit it to Laura.
Online?
I believe.
Yeah, it's on the website.
Okay. Okay.
Or they can probably pick it up.
Yeah, and then we'll need to schedule an interview and all that stuff.
Okay, so I'll just refer them to the website and the online application. Or Lori. Okay, all right.
All right. Next item on the agenda is the meeting schedule for 2021.
So I wanted to just clarify now, of course, COVID threw everything off in terms of scheduling. We typically have quarterly meetings. That's what is outlined in our bylaws. So we had a special Board of Health meeting in January, and I've been meaning to ask Vicki if that would count as one of our quarterly meetings. So then that would leave us with 2 remaining meetings. And I'd love to get a schedule since everything's been scheduled on the fly this past year due to COVID. Do you want to go ahead and set a month goal to have those 2 meetings for the remainder of the year?
That's up to you and the board. I think when we've got them all together at the same time, it's the easiest time, but
Yeah,
we need to do it
where we have a board meeting.
where we have a board meeting. If possible, alternate it between maybe one in Rangeley and then one in Meeker.
That's what I wanted to see, if we could do our next one in Rangeley at least, and then maybe our final meeting, which I've been calling the annual meeting. And what month, do we want to shoot for potentially September for a Tuesday in Rangeley that you guys are already there?
Sure.
Okay, and I can get with Lori to schedule that. So that way Dr. Pristupa, we typically would send these out farther in advance. So for this next meeting, I'll make sure you have an agenda by August for a chance to give feedback.
Please call me just Jeff.
Jeff, will do.
Thank you, Frank.
Oh, and there's Margie. It looks like Margie just signed on. Margie, hate to put you on the spot. It looks like you just signed on. Can you hear us okay? I just saw her on the Google Meet, so I'll make sure she can hear and we can ask her if she's.
Alice, it looks like your Rangeley meeting will be on, if you want to do it August, it's August 17th? Or you think it's September?
Maybe September?
Okay, September would be 21st.
Thanks, Tony. Have a great day. All right, and then the last one I have.
Margie, is that you?
Yes, and I can hear you.
Oh, great. Thanks, Margie. We were just going over membership and wanted to confirm you were still planning to serve on the Board of Health for the remainder of the year.
I would love to.
Great.
All right, thanks, Margie.
Thanks.
All right, so then that means you have a full board now.
Yeah.
Okay, perfect. And so September 21st will be our tentative next quarterly meeting in Rangeley, and then we'll plan for December in Meeker. And of course, anytime in between then and now, we can schedule a special meeting if we need to, just like we have in 2020.
I would suggest that the December meeting, we go for December 14th, and go ahead and set that out right now, because by the 28th, commissioners are struggling to get everything done, wrapped up for contracts and agreements and budgets and
For the year.
and for the year. So if we could do it right now and possibly set it for the 14th.
Would you prefer to do August and November? Would that make more sense, or does it
Your
matter?
budget
I don't
meets
think
in
it matters.
November anyway, so
All right, December 14th?
does that work?
Yeah, sure.
Alice, do you want me to publish those dates on our website tentatively?
Sure, yeah, that'd be great.
Board of Health?
Okay, so, sounds like everyone can hear, since Margie can hear us, so I'm gonna go ahead and share my screen. Okay, anything else, before I jump into the COVID
I
update?
don't think so. Jeff, are you just on the telephone? Anything, Jeff Rector, Commissioner Rector?
Yep, I am, Garrett. No, I'm good with that.
Okay, you're not seeing the screen then, just so you're aware of that. Okay.
Yeah.
All right, perfect.
All right, so just a quick COVID update, and Jeff, Margie, and Diane, I know she's not on the phone, but I wanted, for the benefit of the new members, to remind everyone of our mission statement that we adopted. I believe this was January of 2020, to promote the well-being of the citizens of Rio Blanco County with respect and dedication to our unique way of life by protecting the overall health of our community. So we'll just jump right into our COVID update. I wanted to show you a new addition on the dashboard and then take any feedback questions. We are seeing an outbreak currently in Rangeley amongst youth. So we've been doing a lot of testing, working with the school district to contain that outbreak. We have had one additional hospitalization of a resident of Rio Blanco County since our last meeting. That individual's been discharged now. Don't have an update on their health. So our data here, just quickly, so historic. So we're up to a total of 581 cases, 34 hospitalized. And what we added here to the dashboard is a count of our individuals vaccinated within the county. So this is a number that we calculate on how many people are vaccinated inside our county, meaning via public health or at either of our healthcare facilities.
And is that just a single dose, or is that fully vaccinated?
It's both. So I did put in small writing there. It's very confusing, but the people vaccinated is with at least one dose. And I have an update on what that means, which we can talk about here in just a minute. But I did break it down into the total vaccinations given and people vaccinated with at least one dose, because our state numbers, it matches very closely. I do have a link here if anyone would like to go to the state website at any time and see. I'll pull that up here in a minute. I think it's on the next slide. But the percentages that the state is calculating, they pull it from an information system that has people's addresses.
Okay.
We don't have access to the granular level data, like how many of those individuals were vaccinated out of county versus in county. It's really hard to get that number. However, the calculations, just like with our case counts, I wanted to make sure that we were giving the data that we had and making sure that that aligns. But there's so many reporting delays. There's no guarantee that all of the vaccinations are being reported in a timely manner on the state dashboard. So we have our own numbers, because that's what I can justify reporting exact numbers for, is basically the summary of that. But it matches closely to what you will find on the state and actually national databases. It all kind of comes out in the wash in the end, if you will, with the numbers. So any questions about that or concerns? Let me go back to the dashboard here. Because I know there is a lot of confusion regarding where a lot of these numbers come from. So let me just open it up to questions here. And I'll pull open our current situation also.
Yeah, can you go to that slide that shows number of doses given and that stuff? There you go.
Yep, there we go. So here's,
There's 1,810 that have had at least one, and we've given out 3,184. What is that about?
so total
Over half of
vaccination.
those have had two then?
Yeah, and because it's due in 28 days, so some people won't get their second dose.
Right.
Most people will, so we'll always be on that rolling basis. So someone could be, for example, 2 weeks out from their booster. So it will never be a double. So
Right.
that's the total vaccinations given in the county. And then the number that is of people vaccinated would be people who have received at least one dose. So that's the best way that I can calculate with the most integrity for the data, at least for the numbers, how many people have had at least one dose in the county. Because that's a report that I run that distinguishes between individual patients and numbers of shots given, if that makes sense.
So we're close to a third of our population having at least one dose.
A third of the eligible population,
Yeah, or more.
so 18 and up.
Yeah.
And currently, if you wanted to go ahead and pull out the report card here for this week, it breaks down the vaccination data a little better here on the back. So you can see, I'm going to go ahead and just move slides. We can jump in. I did want to discuss, wrap up a few things regarding this new public health order and the dial and case counts, but let me just move to the vaccine slide really quickly. So we are at 33.1% of our eligible population. That is the number that comes from the state. So if you look at our numbers, it roughly works out. It's lower than I'd like it to be. We're definitely right in line with a lot of other similar counties with similar demographics. So we do see just some general hesitancy in some rural areas. We are hoping to just increase outreach and education, keep offering a variety of options for our citizens so they'll continue to get vaccinated. And we'd like to be closer to 50%. I would like to be there. That's a goal preliminary goal I set. Wanted to ask the Board of Health about that. I don't know if, Jeff, if you have any feedback. I think that's a realistic goal for before July 4th, at least, to have at least half of that eligible population vaccinated, looking at the rates that we're seeing through our clinics. So any feedback on that would be welcomed. Of course, just around us, we're similar to Moffitt. Moffitt's at about 34%. I think Route is somewhere around 66 or 67. Garfield is at somewhere between 40 and 45%. So it makes sense given where we are, but I'd just like to see a little more uptake of vaccine for sure moving forward into the summer.
We have it available, though, is that correct? So it's really up to the population.
Absolutely.
At this point. Like anybody that's of eligible age has the opportunity to be vaccinated if they choose.
Yes.
And that's all we can do.
That is true, and education is important, just people understanding, of course, questions around safety, questions around the benefit of vaccination for not only yourself as an individual, but your community. That's what we'll be working on as far as outreach and education for the next couple of months.
What I'm hearing from a lot of people is, why should they get a shot? They still have to wear a mask, they still might be contagious, it doesn't seem to provide really any benefit. I was wondering if in order to answer them, there might be some measurement between vaccination and immunity, that we can make a link there to show, well, if you get vaccinated, it helps you in some way. I find that data absent. I don't see anything about any relationship between a therapy for its intended purpose. I'm actually trying to figure out why this vaccine is given, because it doesn't have the agent in it. I cannot get measles protection from the chickenpox vaccine, nor vice versa. If the agent is not, admittedly, not in the vaccine, then how can anyone get immunity from the vaccine?
Oh, it's extremely effective. The Moderna has been shown to be somewhere around 95% effective.
That is not there really.
It's an mRNA vaccine, so it's completely different technology.
So that means it's experimental. People are learning that their insurance does not cover them in the event of an adverse event because it is an emergency vaccine, nor is there life insurance policy in effect if they die from the vaccine. I think the public needs to know this.
It's very, very rare, and the data is out there. It does support the safety and effectiveness of the vaccine. I'm happy to share that with you anytime.
Thank you.
And we'll continue to provide that information to the community. So thank you for your comments. Any other questions or concerns about the COVID vaccine? If not, we can jump into the case.
Hey, Alice, this is Margie. Is it a correct statement that some of what the vaccine does is if you yourself get it, it helps minimize your symptoms, making them more more manageable.
Yes, the data
And
has
so
shown that.
maybe that's some of the answer. So if you are a highly vulnerable person for COVID and could have pretty devastating effect from it, the vaccine will hopefully minimize that and make your body fight it better and hopefully not end up into the hospital and those kinds of things.
Right,
And that,
if you end up with COVID, yes, the data has shown that. That's a good point.
yeah,
Marcy.
and so that may be some of the messaging that is valuable.
Thank you, Margie. Any other feedback or input on the vaccine?
So I got a quick question, and then
Yeah.
Eddie had his hand up, but do you think that people are holding off from getting the vaccine in hopes of Johnson & Johnson coming back online? Because I've read a lot of stuff, people only want one shot versus the two.
Yeah.
So do you think that that's partially why our numbers are lower?
Sure, and I've actually got some updates on that. And of course, this was just in the past couple of weeks, the FDA and the CDPHE lifted the pause on Johnson. So Johnson is now available. We can order it if we choose. I was actually going to ask the board if you think I should go ahead and order that now that it's available. We still wouldn't be guaranteed to get any. But what the new studies are coming out, we knew this was coming. Again, this is a delay. Our information is only as good as our data that we've received. So we now, after analysis with widespread Moderna administration, we're seeing that they're looking at around, and correct me if I'm wrong, Beth, 80 or so % effectiveness after one dose of Moderna versus about 68 with the Johnson & Johnson. So they're even encouraging individuals now, if you feel more comfortable taking the Moderna, which is what we carry, over the J&J, even just one dose. Of course, two is still preferred for that full 95% effectiveness, but one dose of Moderna would still be better than nothing at all.
So I'm
So,
saying you
lots of
guys
options.
getting that second shot wasn't.
Oh, no, no, not, definitely not. It's still encouraged and it still gives you the best coverage and immunity. So.
But it's higher than the J&J.
Yeah, the Moderna, yes, it is, after the studies. So far, the data we're seeing. So there's lots of options. In other words, to answer your question, Ty, there's lots of different options. So hopefully now, and again, if we can continue to educate and let people know their options, which we do quite a lot on a daily basis, we're seeing a lot of people who were waiting for the J&J have come and got their dose of Moderna. Just last night after that study came out, even we saw some people who said, well, we're just going to go ahead and get the Moderna, but we're probably going to get one dose. And we said, okay, that's your choice. Absolutely, whatever you find is the best choice for you. So I don't think it will play as big of a role, but I think we'll keep seeing more people.
I think that's a really interesting statistic that it might not hurt for our locals to know, is that even with one dose, you're supposedly 80% effective with the stuff we have available. Because I was kind of going with where Ty was going, is that there are people wanting to do it just with one dose. Mm-hmm. So I think we either ought to get some J&J or really promote the idea that one dose of the other is actually as effective, if not more, than the J&J. That's just where my brain is.
Yeah, we can do that.
Because I don't think everybody realizes that. I sure did.
Yeah, and it's changing.
Not that we're encouraging them to only get one dose,
right.
But still.
Yeah. Sure.
But I think
valid.
To Jeff's concern, he's got some valid points there that need to maybe be tried to be addressed, is that there is a perception out there that there needs to be an incentive to some extent as to why get the darn thing if we're still going to have to wear a mask. And you know, in our community, that's
but we're not
an issue.
Yeah, according to President Biden, he wears 2 masks and has had the shot, so.
So the reasoning behind getting a vaccine, there's multiple things, and I'd be happy to do a separate educational discussion or piece about this. The reason I have my mask on today is if someone in this room is not fully vaccinated, I'm fully vaccinated. There's still a chance that I can have a breakthrough case. I'm doing it as a choice to protect any vulnerable individuals I might be around. It is absolutely everyone's choice. The CDC still does say, even if it's not mandated, which in most places it's not anymore, it's not mandated in Rio Blanco County, wearing a mask is not a sign of weakness. It's not a sign of following a rule that, you know, it's about a choice, it's a personal choice I make to do everything I can to protect those around me. So getting a vaccine doesn't mean you still have to wear a mask. In many settings now, in Rio Blanco County, we don't have any places where it's mandated unless you're in a facility that chooses to follow other mandates that they are held to. That's their choice, but it's still also the choice of the citizen to decide what they want to do to protect themselves and their community. So that's the reasoning behind it, and I'm happy to provide, you know, more data, more statistics surrounding all of those things.
Sure.
Studying this issue since 1955. I was raised by a medical doctor that did not believe in vaccination. I've never had one. I've never been sick in my life. I don't see why I should now take a vaccine.
That's very fortunate for you.
No, it's not an accident. You see, I live according to the laws of nature. I don't get sick because I don't live that way. We talk about chronic diseases. Those are mostly lifestyle type diseases. I'm really looking for a reason why I should, after all this time of practicing alternative medicine, which I've recently retired from, why this instance should be when I start to vaccinate myself. When my body's never exhibited symptom one, reason one of any immune deficiency, any immune inability. I feed my immune system viruses just because they let them beat up on something once in a while. Something drops on the floor, I'm liable to eat it anyway. So I don't see why I'm not being compelled, you see, and I'm a very reasonable citizen. I want to be safer, but I don't see a reason why I, nor anyone of my family, who now 3 generations have not had the benefits of immunizations, and they don't get sick. They don't have a medical history. And I don't see why, based on what, as I look at it, and I do that as practicing, I look at this thing which is supposedly making people sick, and I see the healthy people staying healthy, and I sick people getting sicker. That's kind of how it is. Natural selection. I really am having a hard time equating the evidence of the need for an emergency, which means that the vaccines don't have to be tested adequately because they're approved for emergency use, which means they haven't been tested adequately. We're all part of an ongoing experiment. And for me, one of the major things is freedom of choice. I am first a constitutionalist because if I lose my health, I have remedies for that. If I lose my freedom, I don't have any remedies for that. And I've lost my freedom right now. That's why I speak. Because somebody has to.
Thank you for your comments. I would answer to your question, the reason why would be for your fellow citizens in Rio Blanco County. There are some that are very ill and have had many serious side effects from COVID-19. Even today,
if I take the
speak on behalf
vaccine,
of their
I
health.
can still make them sick according to the authorities. And if I get the vaccine, I don't help them anyway because I can still shed it and still give it to them. And so I'm not actually helping them by taking the vaccine.
But I just think bottom line is it's everybody's individual right.
Yeah.
I mean, if you want to wear a mask, wear a mask. If you don't. If you want to get a vaccine, and you have choices of vaccines. So I don't think that, especially here in Rio Blanco County, anybody's pushing anything on anybody. It's just, you know, if you have, you know, a chronic illness or a pre-existing condition or something, and you feel more comfortable getting the vaccine, then I think that that's your choice. You're right, and you know, move beyond it. But I think it's the biggest thing that I think we're trying to convey would be it's your body, your choice, and you get to choose at the end of the day what you want to do with it.
Yeah. Well, we've clearly got some diverse opinions here, and we appreciate that. I think, I don't mean to cut you off at all, but We've got a couple questions. Eddie's got one back there. Can you speak up? I can't.
Yeah.
Here.
So they already launched the mobile vaccine trailer. And it's going up through like Eagle and Summit County, hitting Mesa, Garfield, skipping Rio Blanco and hitting Moffett and Trout. Do you know why they're skipping?
Because we don't need it, because we're offering weekly clinics on both sides of the county, and that's not happening in those other counties.
Oh, because they're stepping back from the clinics and like that trip.
No, that was just an extra, it was an option, offered by CDPHE. If counties wanted to have additional, shot clinics offered, and we said that we would welcome them, but we didn't have a need because now we're offering in-office appointments for anyone who wants a shot. So we haven't had to turn anyone away. We've been able to get everybody scheduled. So I didn't participate in the planning for that, but we did say, we'd be happy for them to come here. In fact, I think the last conversation I had with Roberta Smith out of Routt County was, we really need a Pfizer mobile vaccine clinic to come through here, because that's something we don't have up here. So we agreed to collaborate together to try to see if we couldn't get a Pfizer bus to come. But they're carrying Moderna, and since we already had that, we weren't a part of the needs assessment. I think they sent out a survey asking if for places that didn't have, that had the need. And so if you wanted to, you could select it. Yes, we did have that need. And so we did not select that we had the need. However, hopefully we can get a Pfizer bus. That would be great to cover those 16 to 18-year-olds, 16 and 17-year-olds that aren't covered by Moderna. So I'm still waiting to hear back from CDPHE on that one.
I have a few questions, Alice. So the Pfizer is now saying you're going to need a third dose about a year after. Has Moderna said that?
There's nothing concrete that I have to report today, Carly.
Okay.
Today,
Yeah.
keywords on the actual booster date. We're hearing about the annual boosters, what we're hearing from most companies at this point.
Okay.
So I have not heard anything official from Moderna, Beth.
I'm not.
So, but that's what we're hearing too. We'll see what Moderna. Yeah.
My other question, are you noticing, is Rangeley and Meeker taking the vaccine about the same uptake, or is there a discrepancy between the two communities?
That's a really great question. I haven't done a true analysis, but from what I can tell, based on population size, and the numbers I've crunched so far, it's actually something I was thinking about adding when I have the time into our report card. It looks like just a slight difference in Rangeley and Meeker, a little more uptake in Meeker than Rangeley. However, we've seen, the reason actually I halted that analysis was the last couple of weeks, we've seen an increase in Rangeley. So lots of people in Rangeley, CNCC's reached out about wanting to do a shot clinic on site. So I'm waiting to see how that might even out or change the
And then my last question, CDPHE puts out marketing on some of the vaccine staff, is that correct? And I'm thinking maybe we could get some of those slides and images and share them on our media profile to help get some of those numbers about the statistics and why you should, if it's your desire to take a vaccine, do it. But I believe CDPHE does that, if I'm not mistaken.
You know what, this is where I have that link. Let me share this link and answer your question, Carly. Yes, so they send out weekly slides from their vaccine update call.
Okay.
So what I could do is potentially start just forwarding those to you, and then if you see something that you think would really work well on social media or our website, we could pull those. And then there's also, I just wanted everyone to see, this is that COVID-19, the CDPHE website that has a lot of information about vaccine. It has the county level data. That's where I pull a lot of those images from, but it also has on the homepage here for vaccines, a lot of info. So they more or less, everything they share is on the website somewhere, but I think some of those graphics, you're right, would be really great to incorporate.
Yeah, if you could maybe push some of that information out.
Yeah, definitely.
Sir,
Al,
go ahead.
in that messaging, would it be fair for the sake of balance to include statistics from VAERS, VAERS, along with it?
Yes,
Balance that out.
absolutely, yeah, and that's actually available. I know there's a link on this website to all of the VAERS data. We do use VAERS adequately or appropriately within our clinic, but it has, and what Jeff is referring to is the vaccine adverse event reporting system. It's nationwide. So if someone has an adverse event after receiving a vaccine, the healthcare provider enters that into the system, and that's how they track a lot of these. So yes, we could definitely include a link to that as well.
Great.
All right, any other vaccine questions? I just
Probably better move on, yeah.
Yeah, I'm gonna do a quick update on, on the PHOs.
Just one quick question, on the vaccine where you can call in to get an appointment, that's gonna start in May, correct? And is there a time period? Are you gonna do it from like 8 to 5, or that's what I've seen of people saying they can't get it because it's in the afternoon or whatever, so I just didn't know if that's gonna be out there for morning folks.
We're gonna wait and see what the demand is. We wanna totally design it around what people need. So
Okay.
we'll likely have clinics towards the end of the week. That seems to be the more popular days. We're gonna have to still try to schedule people in blocks of 10. That's one of the other challenges. However, we're planning to make sure we cover both work day hours and after work day hours. So like we've been doing with the 4 to 6, seems to capture most people with their work schedule. However, the good thing about doing it this way and shifting from these bigger clinics is now we're only seeing, 10 to 30 people each clinic. By having them in office, we have more flexibility in when we can schedule, where we can schedule them. And then if we start seeing a demand, we'll look at weekend options, maybe do a 10-dose clinic at the public health office on a Saturday. So the whole point of switching was to try to get a little more flexibility. So that's a great question, but yeah, we'll try to offer different times and days as much as possible.
And with that, Alice, just so you know, it's on the website, and I'm working with Caitlin from the Herald, and we are pushing out that the clinic structure is changing. The final 2 clinics, community-based clinics, are happening, and then we're going to this. So we'll push that pretty heavy through May, that the structure has changed.
Great. And Pioneers Hospital is still doing their clinics by appointment as well. I spoke to Christy today, so we'll keep putting a link
Yeah.
on our website for
I
that.
haven't heard anything from them in a while, and I never heard anything from RDH on theirs.
I know RDH has stopped, but PMC is still going, so I'll get Christy to maybe send us a link with those.
Yeah, and then I can update our site.
Okay, so just a quick jump, again, on the report card, any questions about case counts or where we are right now, as far as case counts and trends?
Do you think the spike in Rangeley was from prom?
Am
You have to.
I allowed to say yes? Definitely was a trigger event. So the good news is we are seeing it mostly amongst youth, that big spike in cases, so. Okay, let me get my bearings back here. The dial, just quickly, there were a couple of questions, I apologize, I didn't have all the answers to last work session, which I now feel comfortable in answering any of the questions. We really want to make sure, my main question is, communicating to our citizens and our businesses how this is all working. The state website now, it has it pretty clearly laid out. You can see we're in the gray. We're one of the many counties that will not have any public health orders. However, I just wanted to, and I put it in your packet just to review. There's a summary 1-pager. This is what remains of the state order. So again, as always, I've always said, I think it's just important for people to know what is still in effect, what isn't. And then when we're asked questions at our office, of course, we can refer them lots of places, but it's very confusing for people. I found and printed off the resolution passed by Mesa County Board of Health a few weeks ago. Actually, it was passed almost a month ago now. And I don't know if this is just an idea for you guys to look at. If it's something that you wanted to even just put a statement on our website, maybe on the front page. There's nothing really on our website that necessarily clearly says, okay, in Rio Blanco County, we are, doing this, that, or the other. And I love the way Mesa County's website has it laid out. It has their, right to choose policy right there front and center, but then it has links to, here's the CDPHE website, here's the summary of what's still required by state order, so people are aware. They still have their 5-star program, in place for restaurants and businesses, which we didn't ever enact anything like that, but it at least gives people a nice sort of summary of where we are with all of these the confusing situation with the which now at least hopefully won't be ever changing, because we've made it to that point. Just a suggestion, so I was gonna ask the board, what you thought about that, if that was something you might consider.
I think we definitely need to push out what our position has been early on. And I think it's been very consistent that we're not gonna enforce state mandates as far as Blanco County is concerned. I think we have that right now.
That was the May 7th
Yeah.
letter, which Carly, you did push that. Is it on the website though?
It is, you would probably have to dig a little bit for it,
Yeah.
because after the dial expired and all the public health orders expired, we did not come out with a real clear, we just reiterated our stance from the beginning.
Which goes back to the fact that the commissioner said that, we're not,
Hasn't
not
changed
gonna be
anything.
obligated, we're not changing anything. However, they may still be under, like some of the other things that we've done. You're not controlling what CDPHE does if they decide to send out a health inspector. There's no control or guarantees or protections for that person. I think Alan's had that conversation with them. You can do this, understand that this, your license through DORA, he has no impact on what DORA says.
But I think we do wrestle with the idea, we have some population, whether it's businesses or otherwise, that think every time CDPHE changes in our county, that the county hits the reset button, and we don't. Our position has been consistent, and we need to make that clear.
And the Mesa County resolution is pretty good. It's you do you.
And I think we chose not to necessarily pass a resolution, and we talked about it. We could, if that would be clearer, but
Well,
our position's been the same all along.
I think that would send a message. I mean, if what we're trying to do is send a message and make a statement, then I think by passing something similar to that would do that, would accomplish that.
And Mesa's free of any public health orders. And it's still, schools are mandated by the Department of Education.
Which is, that's beyond our,
Yes,
that's their choice, but that's beyond our.
that's beyond.
Personal services are still included because they're licensed, anything licensed under DORA
The toe.
is covered. Has to.
Well, just personal services, there's lots, not every
I got no
DORA,
problem.
occupation, but,
Okay.
and it's in
Haven't
that,
changed
so all of that
education,
info
yeah.
is in this one pager for the board here, if you guys wanna, that was just, the best summary I found that actually tweaks out everything that's in the new updated order, and then, this copy of Mesa. So again, it's just reiterating, my job is to communicate, is educate, to protect people's health. I'm not necessarily the vehicle for the political stance of Rio Blanco County, nor am I the appropriate vehicle for that. So I want to give you the opportunity, as it relates to public health orders, when we get calls every day, and we still, as we have from day one, reiterated that that is not our stance, that's not enforced, et cetera, et cetera. But that doesn't mean that people aren't still confused. It's very confusing, so we want to. And not everybody's on Facebook, so just even if it was a statement from the board, would probably be helpful for us. So we could put it either on the website on our front page, or we could, something that we send out. The email that we sent out to the businesses that I made sure had the statement from you all. You just think about it. That is just our businesses. So there's probably people who aren't on that email list. There's citizens that are still confused when they go into a business. So just any broad messaging, really just summarizing it would be great and helpful, I think, to our department.
And I think one thing that could help is we could very clearly do something on the website, push it on social media, and maybe do a ad in the newspaper that just says, here is Rio Blanco County stance. We don't regulate DORA, services, we don't regulate schools, we don't regulate hospitals. That's that.
Alice, this is Margie. I had an opportunity to hear Jeff Kerr speak last week to a chamber event in Grand Junction to the businesses about Mesa County stand, and I thought the way he kind of positioned it was really good, because he talked about with this, free to choose, that they aren't. Mesa County's not shaking their finger and saying you need to wear a mask. However, he did call out that we need to be courteous to businesses that are regulated beyond our county level, And so if you walk into a business that may be regulated by DORA, know that help that business and comply. If you go to the airport, you have to comply. And so I think if we message it in a way like that, in the sense that Rio Blanco County believes in free choice, but we all, our businesses sometimes have to work within the regulations outside of the county. And so please be courteous and respectful of them trying to do the best they can. That's all you're asking people to do is be courteous of the situation.
Margie, this is Jeff Rector. Can I answer to that? I think you're exactly right. And the problem is through Rio Blanco County, we've tried to give the people the pro-choice to do that on one side or the other. But at the very end of it, we need to be respectful of people. If they want to wear a mask, they want to get vaccinated, or they don't, then we're okay with that.
That's right.
But please, just let's give people that choice of whichever direction they want to go. We know through, you go back a year ago when this COVID first started, we pulled the trigger on Rio Blanco County and we shut the county down for 2 weeks. I look back at that now and I'm thinking that wasn't a very smart decision. But today I look at that because it took quite a while for us to get some case counts there. But really at the end of the day, if you want to if you want to wear a mask or you want to get vaccinated, we need to be willing to say, okay, we're okay with that. We can't start looking down our nose at people. And we've got several special districts in our county that have to do that. And they have to comply to some state mandates, some state orders. And we understand that at the end of the day, guys, we don't want to overstep our bounds. And so, yeah, we need to be respectful of one another through this thing.
And I'd like to add to what Commissioner Rector just said, is I think that, let's be honest, we're talking about public shaming on either side of this, and it should not occur on either side. Whether you choose to wear that mask, whether you choose to get that vaccine or not, it should not be peer pressure either way coming from Rio Blanco County is my thoughts on it.
Nope.
Okay.
Commissioner Moyer, that's a great way to say that. You're exactly right. We shouldn't be shaming people into one way or the other.
Yeah. I think you guys have handled and balanced this well. Very much. It's been a difficult year and a lot of walking on a tightrope with it. But I think for Rio Blanco County, you've navigated it well. And I think to continue that messaging of Rio Blanco County respects it. You have your choice to mask or not to mask. The only thing we ask you is take into consideration guidelines others have to follow. Our schools, our hospitals have to follow other guidelines and then carry on, but to message it out in a way that's not real, that's a little bit just conversational, I think would also make your point, because when you're having an easy conversation with somebody, it's not judgmental. And that's what you're trying to get across.
Well, and Margie, I think to go back to that point, I think what's happened is we've not always agreed with our public health department. They've done a great job, and Alice and her team has done a great job, but we haven't agreed with that. So what's happened is we've got that adversity back within our community that, well, God, those commissioners are being a pain. That's not the point. We have not changed our program from day one of this deal. We want people to be able to make that choice, that if you want to do that. If Margie, if you own a business and you want to say, hey, you got to wear a mask, and if I don't want to come in there, I don't go in there. If you tell me I don't have to wear a mask and I want to go in there and patronize you, I can do that. That ought to be that freedom of choice for these individuals in Rio Blanco County. And I think that's why we all live here, because we have that ability to make that freedom of choice.
And I think, you know, you have been saying that all along. And even though there's been some tough decisions along the way, that you're allowing the freedom of choice. I think what happens is sometimes you have to refresh that message so they're hearing it again.
That's what I'm saying, yeah,
Okay. Yep.
exactly.
Could I say one other
Thanks,
thing?
Marcia.
Certainly.
I appreciate everything that Jeff and Margie just said, and I completely agree, but I think just take it, look at it. What I'm trying to get across is that my message being about public safety and health, right? I want people to get vaccinated. We want individuals to take care. That can't, I can see how that might be misinterpreted as a political message. It's not. It's completely scientific. So that's where I'm asking if there was a way to communicate that in a balanced way. Like Margie said, Jeff Kerr, he's the director of Mesa County Public Health, and I've actually tried to mirror him throughout this pandemic and a lot of my messaging to the public. So anything we can do, I think everybody's right. So just look those over, and that's the reason I brought that to you today, that resolution from Mesa, just so you can see it. If it's something you want to do, great. If it's not, just get with Carly, let me know if there's anything we can do differently, you know, to reframe the message, but we'll continue.
Well, I
educating.
believe that our statement that we've been putting out there should be included in any communication where we're putting out all the state guidelines currently, so that at every opportunity, we're letting the public know, here's what the state's recommendation is, here's where Blanco County's at. Like you say on the website, it shouldn't be something we have to dig for. It should be front and center along with all these other recommendations.
If I'm hearing right, I think that's a Carly,
Yeah.
You can get on the website.
something like that, to put that.
And anytime this goes out, just like we did with your communication to the business, we want our statement, and if we go ahead and do a resolution, then that could replace that, but,
Well,
that
even with the
needs to
resolution,
be.
you know, you put it out there once, and I don't know how many people go back and look at our
I know.
resolution, so that would be important to
Mhm.
continue to push that out.
Yep.
So if the directions will certainly.
Sounds good.
Well, and Commissioner Moira, I think that you're exactly right. And the problem is what's happened is we've got divided a little bit between the board and our public health department. And that's not because there's a big disconnect between CDPHE and CDC on their guidelines that come back. And we've tried to give our constituents or set up some guidelines that people could make that pro-choice. And it was never about a division between public health and, well, might have been a little bit with CDC and CDPH because we just didn't quite agree with a lot of their stuff. But really, we don't need that division between our own public health department and the Board of County Commissioners.
Well said.
Yeah, and I think, you know, just the observation I've had here, you have moved past that. And if you keep leading by example and working in tandem like you are doing on this call, then that should just go away. If you let it go away. We learned, you guys are reconnected, you're working in sync, and so it's done. It's over.
Cool. Thanks, kiddo.
On that note, let's move on.
Move on. So this, just real quickly, we're over time now. Just wanted to make sure I shared these updates with you. Of course, public health is a lot more than just COVID. So I just wanted to let everyone know, I printed off a copy of our departmental goals that we approved, the Board of Health approved again in January of 2020, I believe. Or it's not, maybe it was 2019, December.
That's what we said, there's not going to be a pandemic.
I know, seriously, we sat there, and it's crazy to think about. We had my top chosen topic for the Board of Health meeting, that first one in September of 2019 was pandemic influenza. Just as an educational topic, I picked something, I thought this would be good to talk about, because we need to be prepared. Anyway, so these are our 5-year departmental goals that we approved on. So I just wanted to give all of now we have a almost completely new board, minus Gary and Jeff. I wanted to make sure everybody saw those and knew that those were, and I believe they're on our website. We have them on, Michaela had helped me create a tab.
Okay.
we need to look at that probably just to make sure, revisit. We're moving ahead with our county health dashboard again, with our DUA signed with PNC. So there's a lot more I want to add to our website now, that's not got anything to do with COVID or only just related to COVID. So these are those goals. I invite any feedback from our board members, new board members, but I just wanted to point out two things we are currently moving ahead with to catch up for 2021. So we're partnering with our school districts. We've offered to both Meeker School District and Rangeley School District to offer a back-to-school shot clinic for childhood vaccinations because we're still behind in MMR and HPV and meningococcal and Tdap vaccination rates, and that's some stats here. So this was one of our goals before. So this, I think, can go in tandem with COVID vaccination. We're just going to try to continue to educate, but offer. I think it's worked really well. Rio Blanco County citizens have given us overwhelming feedback that they love the drive-through flu shot clinics. They thought that was just fantastic to be able to just drive through once a year instead of having to make an appointment. So we want to do that with our schools and go to the schools and say, back to school shot. Everybody knows what a pain it is to get their kids all to school. You know, it's a rush in early August in public health to get those shots. So if we took it to them, we partner with the health clinics as well. So I know Meeker Family Health Center has offered to help, and we could just go together and just offer that vaccination for parents and kiddos that want it. So we are doing that. And then family planning, this is just something I need to make sure I put out there. So currently, our Title X contract requires that we have a provider who can come in-house and provide services. So this has been a whopping total of 4 hours, actually, of time, even since we've received the contract at July 1st. So it's not a huge chunk of time. Both of our hospitals have expressed the interest in wanting to collaborate with us. The big issue, of course, we want to prioritize, the need for providers for primary care in our county. That's hard historically to recruit and staff. So we would never ask, our clinics, of course, to give us a provider, even if it was only a few hours a month, if it was something they couldn't provide. But it's important for the board to know we lose that funding, the federal state funding, if we don't acquire that by July 1. So I'm keeping in close contact with RDH and their situation there with the providers, and they are, willing to send someone down when they do have someone fully trained and ready to go. But Pioneers has also expressed desire to send someone. So I have an IDA that Vicki has. She'll be going over with Don to present to PNC to see if that's something that either or, that way between the two sides of the county, if we can have one provider able to fulfill that couple hours a month in a public health office, that would work. And I talked to the program, they said that would be fine as long as there's somewhere people can go within the public health office. And we will be looking at about another award amount of $41,000 for this next fiscal year. So that would cover the entire cost. That includes women's health, a lot of, that covers contraception for anyone who's not insured, pap smears, STI testing. We do a lot of things. We serve a lot of people. So I think it is very important to continue that. But I wanted to just update you on where we were. The only other alternative would be hiring an independent provider, which would include a whole different set of legal issues. We'd have to insure them. We'd have to, have a totally different contract to actually hire a provider directly versus through one of our local clinics. So I'd like to still pursue that option as long as both clinics are still willing and able.
And Alex brought this to the attorney's office back, I think in January, February, I think we've been working on it, but then it was kind of one of those things that COVID was going and different things were going, so that has transferred to Dawn. So I will get with Dawn and get those documents to him, for him to shore up, which he may have something similar to his two other counties. Yeah. So and Alice and Dawn, I'm gonna try and set up a meeting between them so they can get to work.
Perfect.
All right, and that's, any other questions about that? I'll just keep you updated, and if we get to a point where approaching July 1 and we haven't had success, we'll just have that discussion as to what we want to do with the program. Because of course it will cost the county to continue it if we don't have that funding, and we can continue doing that like we did in the past. But I was preparing for the Title X funding and the budgeting for the next year. So Okay, if there's no other questions, that's all I have. Is there any comments or concerns or questions from any board members or issues, things you'd like to see added to the goals, or for next, meeting? Of course, you can email us also. But that's all I have for today.
Thank you. I think we've had a great discussion here today, guys. So, does anyone have anything else? All right, we will adjourn this, I believe.
Thanks, everyone. Have a great afternoon.
Thank you for getting on, Margie.
Thank you.
And Jeff.